Welcome to Philly Tech Connect podcast, where Philly's tech minds meet. CEOs, developers, dreamers. This is your space. Each week, we explore the journeys of tech innovators. Join us and be inspired.
Hey everyone, Dave here with another episode of the Philly Tech Connect podcast. Today I'm speaking with Sandeep Banga, the founder of Scribble, an AI-powered clinician assistant that automates visit documentation for home health. He's also the CEO and founder of CuteEdge, a social enterprising company that works primarily with nonprofits and specializes in driving digital innovation. And with him, he brings decades of experience in strategy, leadership, and technology. Sandeep, how are you doing?
I'm doing well, Dave. Thank you so much for having me.
It's a pleasure. Love speaking with individuals such as yourself who have decades of knowledge to share with our community. I always appreciate your time. I'd love to hear about Scribble because I know this is a relatively new product. I saw your announcement on LinkedIn a week or two ago. You kind of announced your position change. But as I looked at the website, I could tell you've been working on it for a long time because it's packed with a lot of features and things like that. I know this didn't just come out yesterday. So tell us a little bit about Scribble and why you feel it's the right time to launch this product.
Yeah, absolutely. And we're so excited about this product. It's a new product that we have. It's AI-powered home health clinician assistant. Just like you said, it helps nurses mostly because those are the clinicians in our home health space, automatically document their patient visit. Now, you probably are aware, Dave, Americans are aging faster than ever. And so with that aging population, people want to be cared at home. And that is driving the demand for home health services. And like I said, nurses are the sort of the main clinicians that serve that space. And we're not producing enough of them. And so what we set out to do was with this application is to help increase the capacity of the workforce that we have available, right? These clinicians in the home health space. So yeah, just excited about the possibility. And now with the Gen AI being available to us as a technology, things that weren't possible before, like even a couple of years ago, suddenly become a possibility.
It sounds really cool. My mother is a retired nurse, but so great to see innovation in that sector. As someone who has gone to, doctor's visits and things like that, I'm used to maybe like a dictation after they speak with me to kind of describe, the conversation and they'll leave notes for themselves, which I'm assuming is just a reference that maybe they then transcribe into some software or platform down the line. And I never know really what happens afterward, but this functions a little differently. So tell us a little bit about the technology or the user experience.
Yeah, great question. So the level of innovation that has happened just about like maybe a year or so ago, like before that period, has been in speech to text. So and my wife is a physician, like you mentioned, Dave, earlier on, and I've seen her come home and then dictating her notes, right? And that's been the norm in the healthcare industry. What this is doing is pretty much taking notes as the physician is or the clinician is doing their work. So they're not having to do the work, meaning see the patient and then turn around and do it again, and then having to, talk into a machine and almost like unnaturally, right? Like full stop, next line, don't have to do any of that. So it's just an ambient listening device that is listening to what the conversation is and then transcribing it. And then we don't just like provide you with notes, we're actually filling out your CRM or your EHR with the different responses that need to go into wherever they need to go. So just trying to take all of that work that is right now being done by the nurse or the clinician and automating all of that, not just like giving them a summary or a note summary or a dictation summary.
Yeah, but really owning the entire workflow, which seems cool. And then I read that you can kind of make edits to the form filling, the answers that it provides, so that if you want to make some additional comments or change what's been written, because nothing is, rarely like 100% accurate at this point, you can do that as well. So it seems like you've really thought through the full user experience and the different potential objections or pitfalls that someone might have to using this. Is this something that you have been, getting your wife's input from as a beta tester, or has she played a role at all in this?
Absolutely. She was an inspiration behind this because, again, seeing her come home and having to do that again and again. And then I have a background before I started at QEdge, the company I started about 17 years ago. I used to work in a health IT company. So I have people that I've known from for so long, just friends in home health space and acquaintances, and just hearing from them the challenges that they have. Nurses, especially, they have it hard. So they're seeing about 5 or 6 or 7 patients every day, and they're going out to their homes and doing that, and then coming back to their home or the office, and then spending hour and a half, 2 hours just typing in notes. And nobody wants to do that, right? And doing it day in and day out, which is why like the attrition in the home health space is like 50%. So meaning, 40, 50% nurses leave their agencies in the very first year, and some of them never come back to the home health industry, right? So what we're trying to do is like to create a win for agencies so they can retain nurses, and for nurses to have a better work-life balance.
Yeah, it seems like a great use case for AI. There's been a lot of criticism of AI, since it's kind of really been released and kind of is out there in so many different places, that it's been taking over the creative side of work, creating images, designing things, developing code. And, that's where people, I think, get concerned about, oh, is this going to replace me? What you're proposing here is just to remove the remedial tasks of the job that really just leads to kind of burnout. I love that you're going to be saving your wife some time in the evenings, while also adding more to your plate in the evenings, because now you're launching this new business that you didn't have
Exactly.
before. So it's
Yeah.
a little bit of
They're not
seesaw.
going to be getting any more home cooked dinners from me for a while.
Yes, not. On that topic, you have been running like GDEdge for close to 2 decades, which is quite a long time for a company these days to even be operating. How does it feel to be kind of, starting from scratch with this brand new business?
So yes, I've been running a QRES for 17 years. Along the way, I've built products, started out in different services. So it doesn't feel like I'm starting something new. Yes, it is, but it's been sort of going on for a while, right? Why it feels a little bit different is because of this new innovation in this space with AI being available to us as technologists. That wasn't a possibility. So it just seems like we've just kind of moved forward leaps and bounds versus like just an incremental leap. Yeah, like it still feels like an extension of the company that I have, and in kind of the same space and solving similar challenges, which we do on even with our nonprofits that we work with. They have the same challenge. There's a lot of there's a lot of time spent on things that they don't want to spend time on, documentation being one of them, right? Getting a holistic view of their clients that they serve. Reporting is a big issue on that side too, and all of these sort of, I see in the healthcare space as well.
I'm curious, how you communicate to the team, or whether this is a big deal or not, about the project. As someone who runs a marketing agency, but also likes to dabble in software, I'm always a little insecure about announcing to my team a new venture, because it implies that some degree of my focus is no longer going to be with them and in the company. And so did you run into that problem at all? And if so, how do you address that?
I think the space that we've been operating in for the last maybe 16, 17 years, we work with Salesforce as a technology, as our platform. It is innovating so fast, and we're kind of used to that stuff. So, every year, so I was just at the Dreamforce event in San Francisco, which is Salesforce's event, and they announced Agent Force. It was all about AI this year, right? Last year it was AI kind of starting, but it was all about data, right? So we're used to this sort of, in this rapid innovation, like 3 times a year they do major releases, and all of our consultants, all of the people I work with, they have to kind of be up to speed with that stuff. So I don't think it's a surprise, and I didn't see any of the, like, okay, what's going to happen now kind of moment from anybody. I think it's exciting for everybody because, again, things that we do in one space kind of affect and can be, translated in another space. Interestingly enough, the organizations that I work with at the acute edge side, which is also the Scribble side in a way, but the organizations that I work with there, some of them are both, and they're providing social service as well as home health services or healthcare services. So we've kind of been operating at the crossover of, this customer base. And so it doesn't feel that different to us.
Makes sense. As I was on the Scribble website, I noticed that it appears to currently be in a beta.
Mhm.
Are you envisioning sort of a self-service model where people will sign up in a kind of typical SaaS monthly subscription, or is this another approach to go to market when eventually you launch it fully?
Yeah, I would like to make it as easy for people to use it as possible. Right now, where we're at is we need to do more work and just working with more and more customers to get it to a place where we feel comfortable that it can be, scaled. So we're learning from the work that we're doing, we're improving the product, we're getting it to a point where both in terms of for it to be easy to use for clinicians, effective, doing what it's supposed to do, but also then, easy to purchase, like you said on the website. So that would be the direction we would be going, but we're ways off from that right now.
With respect to, the product and development, obviously you have decades of experience working in technology with various nonprofits. I don't know to what extent you've had healthcare clients in the past, but it always feels like an industry that probably has a lot of complexities because of the
Yes.
patient data and HIPAA compliance are things that I don't know much about, but I assume that you don't just get to kind of slap something together and put it out.
Yeah.
Are you leveraging your experience here in order to know how to approach this, or were there a lot of unforeseen complexities when it came to developing an app in this space?
Absolutely. And that's a great question, which is also one of the reasons we're not like rushing to market and be like, it's not like another SaaS product. It's not like a AI note taker, right? There's more to that. Like there's data sensitivity. That's number one thing that we're thinking about, on top of then actually making it a product that is, usable and it's actually helpful. The industry that we've been working with in the nonprofit space is regulated. So we can, because the work that we do is most of it is with health and human service organizations. So like I mentioned, a lot of them are providing health services as well, alongside like maybe providing workforce development, food pantry, right? Like, and so we have been operating in that space. There's a lot of PII that we deal with, sometimes PHI that we deal with. So we've been sort of, working with customers, kind of working in HIPAA, working in other types of data security. So, but you're right, like now it's kicking it to the higher gear. So it's even, being even more sort of thinking more about like, how do we make sure that we just, like all the areas that we can possibly we look at to make sure that our customers feel secure and safe with what we're building.
Sounds like quite the challenge, but I feel that you're up for it with everything that you've accomplished already at Acute Edge. Sandeep, for people that want to learn more about you, Scribble, what's next for the product, where can they go to find you and learn more?
So I'm active on LinkedIn. You can always follow me on LinkedIn, follow Scribble on LinkedIn. Scribble is goscribble.ai. That's our website. So feel free to visit that for updates as well.
Thank you so much.
I appreciate it. Thank you.
That's all for today's episode of Philly Tech Connect. Join our community at phillytechentrepreneurs.com. Special thanks to our sponsor, shortlist.io, a digital marketing agency specializing in top-notch link building, content strategy, and web design. Stay innovative, Philly, and see you next time on Philly Tech Connect.